This podcast contains our own personal views not associated with any organisation. Coronial contains descriptions of death inquests that may be graphic and disturbing to some listeners. Discretion is advised. Hi everyone and welcome to today's episode of Coronial. I'm Emma.
I'm Alice.
And I'm Georgie.
So thanks for joining us. We'll be looking at the coroner's report into the death of Mr. Tony Bugeja, who died on the 5th of March 2014 after being stung by a wasp or multiple wasps.
Ooh. I have to clean wasps off my house this week. So
Maybe
this is
don't.
going to be really enjoyable.
Yes, this might be topical for you, so listen in.
Okay.
Get the caretaker to do it.
Yes.
I don't think that's going to happen. But like
Probably
genuinely,
not.
I'm like, oh, I wonder if he would. Anyway, go on.
Tony had a severe allergy to wasp stings, and despite apparently using an EpiPen to counteract the venom, he suffered a fatal anaphylactic reaction while waiting for an ambulance to arrive.
Oh.
This death was reported to the coroner as it involved a sudden death due to unnatural causes. So Tony was 50 years old at the time of his death, and he lived on acreage in Wilberforce, which is a small semi-rural town on the western suburbs of the Sydney Greater Metro area.
Oh, so it wasn't even that rural.
Not
Okay.
rural, semi-rural, like kind of,
Yeah, but like,
farmish, but
not
okay.
super.
But
So,
you're not
so
in the
farmish
rural.
that, yeah, like an ambulance might have taken a while.
yeah.
Okay, yeah.
So he was a truck driver by profession and was described as a hard-working person who took pride in his work. So, very house-proud family man.
Aw.
Tony first became aware of his allergy to wasp stings in the late 1990s. After a second admission to hospital in early 1999, Tony was prescribed an EpiPen, which is a portable adrenaline injector, that he was required to keep with him due to his severe wasp allergy. Over the years that followed, Tony was stung by wasps on a few occasions. On those occasions, he administered the EpiPen, which resolved his symptoms successfully. On these occasions, he did not require hospital admissions and he never called an ambulance, so he was able to just use the EpiPen. Problem solved.
Is that normally something you would call an ambulance for, though? If you've just used an EpiPen on
You are
yourself?
encouraged, if you use an EpiPen,
Yeah.
that you, in fact,
Just in case.
seek some medical advice
Yeah.
because one may not be enough.
Yeah.
But I get that, like, the moment you then end up in an emergency department, you have a minimum 4-hour wait, and that can be really
Yeah.
tedious.
Right. It's encouraged.
Yeah.
Absolutely.
But then, like, you would have to go to your
Absolutely
GP
encouraged.
to get another script for your EpiPen, right?
Yeah.
So you would have to be, yeah.
And so that's the
Yeah.
other thing of you can go home from an emergency department with a new EpiPen.
Yeah.
You get a replacement straight up rather than having to wait until you...
Right.
The next time you're able to
Yeah.
see your GP and get to the pharmacy.
Yeah.
Yeah.
So Tony did regularly visit his GP when he needed further EpiPens,
Mhm.
and his final prescription that he got for his latest EpiPen was made on the 28th of March 2013. So
How long before his death was that?
he passed away on the 5th of March 2014, so just
About a
under
year.
a year.
Okay.
What sort of expiry do
I think
they
it's
have?
1 to 2 years. It's not super long. Like, you can't keep them forever.
For years, yeah.
I mean, this all comes up, so
Okay.
Oh, okay.
don't get too excited.
But also, how often is he getting stung by wasps?
Well, he lives on acreage. Like,
Yeah,
it's
okay.
I don't think it's common.
Yeah, I'm just
But-
thinking, I think I've been stung by a wasp once, maybe, in my life.
Yeah, but he lives on acreage. He lives on
Okay.
a farm. He does property work.
Yeah,
Like,
okay.
there
He's
are
a bit
wasps
more
there.
exposed.
So on the 5th of March 2014, Tony was at his home and his wife and children left the house sometime during the morning. Tony was working on the construction of a new family home on the back of the property.
That's
He's a very
devastating.
handy person.
So at 1 p.m. that day, there was a phone call between Tony and his wife where Tony indicated that he just stopped work and was going to have some lunch. Nothing else remarkable on that phone call. He didn't seem
Yeah, right.
stressed or anything. It was
Yeah,
just
he hadn't
normal.
he hadn't already been stung by a wasp or anything.
Yeah,
like
He
that,
had not
wasn't
been
he?
stung by wasp at this
Yeah.
point. At 2:42 p.m, Tony made a call to 000 from his mobile phone. He advised the operator of his details, so his name, residential address, etc., and his phone
Which is
number.
always what you want to do as you're having an anaphylaxis.
Mhm.
Yeah, sorry, go on.
And it was apparent to the phone operator that he was having breathing difficulties.
Right.
After 65 seconds, the call dropped out. The operator attempted to return the call twice, but they were diverted to Tony's voicemail service.
Right. But he had at least given them his address at that point, so they knew where to go.
And they knew his phone number, etc., to call him back as well.
Okay, that's good.
Tony's call resulted in an incident being created, and the job was classified as a 1C, requiring an immediate ambulance response with lights and sirens.
Okay, good.
That makes sense.
Whew. For a minute there, I thought you were going to be like, and they did nothing. And they elected to not send anyone.
That's the end of the story. No. So, obviously, it's not known about the exact sequence of events that happened to Tony because he was alone. But the coroner made comment about the likely scenarios that happened based on the evidence. So, the medical evidence made it clear that Tony died from an anaphylactic reaction. He was highly allergic to wasps, and there was at least one wasp's nest on the property at the time. From this, the coroner concluded that it was almost certain that a wasp sting caused the anaphylaxis. I think there was some different blood levels as well. And I think there was some sort of level showing that there was paper wasp venom.
Oh,
interesting.
Or there was some sort of
I was going to say,
because
it could have been some new thing that he was anaphylactic to. But
yeah, no. So there was no direct evidence about the timing of the sting, but obviously it probably happened shortly before the 000 call. He's not going to be got stung after that. That would make no sense.
Or it's not like 4 hours, this morning I was stung by the wasp,
Yeah, especially if he called his wife at 1 p.m. and he was fine.
Yeah.
So that's right. And then this is 2:42 p.m. But he possibly made this call after he tried to inject himself with an EpiPen.
Which sounds like from the previous instances where he did administer the EpiPen, then not go to hospital and not call the ambulance.
Mm-hmm.
That probably sounds like it would have been the first thing he did.
Yeah, that's
right.
right.
And it's only then when he was like, okay, I'm not actually getting much better.
Something's still wrong.
I need to call the ambulance.
And that's the inference that the coroner made.
I was going to say, and take it back to the conversation before of, one might not be enough. And so you should be calling because then at least you can get more and you can get observed or whatever.
Yeah, because maybe he waited a little while after giving the first one to himself to actually call them, whereas if he called them at the time.
Yeah, but that's why I encourage that even if you're using it, you should just seek medical review.
Yeah.
Right. Yeah. So there was an EpiPen located with Tony, so he was found in the bathroom, and there was an EpiPen found next to him. And there were a number of marks on his right thigh consistent with EpiPen usage. So evidence suggests that Tony tried to inject himself with the same EpiPen a number of times. It's not known why. Potentially he was getting really
he could be panicked,
and he just sort of kept
or
on.
it was also just not lucid anymore.
Yeah, that's right.
Might have thought he'd grabbed a new one or whatever.
Mm-hmm.
Was there any evidence that the EpiPen was malfunctioning?
No.
Okay, so it had been delivered.
Well, they assume
correctly.
So. They did obviously, as I said, take his blood in the autopsy.
You can't
but
tell.
They couldn't find any adrenaline, and apparently that's normal.
Yeah.
Yeah, right.
It's got a half-life that is so short.
Yep.
I wonder, though, because you said he was, multiple jabs and stuff, though, there's still a risk he could have accidentally done it upside down or something and it actually sprayed out or, didn't actually go into his muscle if he was panicked. And so may not have got himself an effective dose or something like that.
Yeah.
But he has used one a number of times before.
Yeah,
so
he has, and there was
hard.
no evidence of that.
Yeah.
There was no evidence of the EpiPen being used incorrectly.
Yeah.
Yeah.
Yeah, but he used it multiple times. So
but
that is still
used it multiple times.
That is still incorrect use in a sense.
True.
But yeah, certainly one of the things that when you're getting trained how to use an EpiPen is there's lots of jokes around don't do it the wrong way around, and often it's someone else trying to inject the person having anaphylaxis and they accidentally inject themselves.
Yeah, that's not ideal.
So Tony kept 2 EpiPens in the kitchen cupboard. After his death, the second EpiPen was found still in the kitchen cupboard. So the coroner concluded that Tony accessed the kitchen cupboard once he started to feel the symptoms of anaphylaxis coming on, and the evidence was that from his wife that he was very familiar what his anaphylactic symptoms were, so he knew when he was going into.
I'm also quite concerned though he should have been taking one out on the farm with him when he was working. He shouldn't have been leaving them in the cupboard because where are you going to get stung by a wasp? It's not generally inside.
Yeah.
Because if he was far away from the house, he wouldn't have been able to get to the kitchen cupboard. But anyway, go on.
So, he accessed the kitchen cupboard once he felt the symptoms and he removed the EpiPen from its box. He then went to the toilet and sat on the toilet and administered the EpiPen to his thigh multiple times.
Yeah. some symptoms of anaphylaxis include gastrointestinal symptoms.
And
might
that
have
was
explained
like
why
his-
he was in the toilet.
That was one of
just
his
to clarify.
symptoms.
Yeah, I was like,
that makes sense.
you don't need to be.
that. He got the sweats, needed to vomit, needed to use the toilet.
But I was like, that
explains why he was on the toilet.
Yeah. Most people don't necessarily just like casually go sit on a toilet to use their EpiPen.
Yeah, no, he was like, he needed to go.
Yeah.
Okay.
So it's not known why Tony didn't use the second EpiPen, although according to his wife, one injection had resolved his symptoms previously, so it was likely that he thought that he only needed one.
And then if he was not particularly lucid, he might have thought he had the second one, which is why he then injected himself again.
But certainly explains why he wouldn't have grabbed the second one to take with him at the same time.
Yeah, because he was like, well, one usually does it, so I'll grab the one. We'll be all right.
That's right. So the coroner concluded that Tony likely lost consciousness quickly after making the 000 call.
Which explains why he didn't pick up the phone.
Oh, yeah, did it cut out because he actually hung up on them because he was passing out or something like that? Yeah.
So around the time of the 000 call, there are around 11 operational ambulance units in the region. 2 of those units were available to respond to the call, an ambulance and a single rapid response unit. The ambulance acknowledged and accepted the job at 2:46 p.m. Remember, the call was made at 2:42.
That's pretty quick.
So very quick. But this ambulance was about 35 kilometres away from Tony's home, which according to Google Maps, and this is something the coroner talked about, he obviously Google Mapped it, was about a 45-minute drive.
But lights and sirens maybe a little bit quicker?
Bit quicker.
Okay.
So due to the distance required to be covered by the ambulance, the control centre operator contacted the rapid response unit and asked if they could also respond. So this job was assigned to that unit at 2:48 p.m, so a couple of minutes after. Yep. This particular unit was 22 kilometres away.
Still quite a while, though.
Away from Tony's home, which is about a 25-minute drive.
Yeah, that's a long time for him to wait.
Maps. That's right.
Especially if he's already lost consciousness when they're being dispatched.
Yeah, don't get me wrong. I'm not saying that that's an inappropriate amount of time for them to have responded, but for him, that's critical.
That's critical time. So the paramedic from the rapid response unit was the first to arrive at 3:07 p.m.
Oh, okay, yeah, that's...
So it took him 17 minutes after he was assigned the job to get there and 25 minutes after the 000 call. So still a pretty rapid response.
Considering how far away they were. Yeah.
But clearly, unfortunately, not quite enough.
Yeah, that's right.
In his instance.
So on arrival, the rapid response paramedic entered the property and encountered 2 of the family dogs at the gate called Roy and Friday.
Were they friendly or foe?
They were Italian sheepdogs, Marima breed, and the dogs began barking at the paramedics.
They are notoriously quite protective.
Yeah.
And can be very aggressive.
Yeah, right. So that would have been really terrifying for that paramedic.
Yes, and they're quite big dogs too.
Yeah.
And 2 of them.
Yeah. And it's
probably
not like
would not go into
Tony's going to have put them away before he's gone for his EpiPen.
No, because he wouldn't have predicted any of this is going to happen.
Yeah.
Oh, well, he didn't grab the EpiPen and then be like,
put the
come with
dogs
it.
away.
Yeah, exactly. He's got more pressing issues.
Well, that's exactly right. So the dogs began barking at the paramedic, who contacted the ambulance radio advising the presence of dogs and requested urgent police assistance.
Right.
Yeah.
So after some time, the paramedic was able to make some further... It was a big property, so there
tried
was a couple
another
of gates
entrance.
and these dogs
could find somewhere the dogs couldn't get to.
Yeah, that's right. So he managed to make further progress towards the house, but as he started to get close to the front door, Roy and Friday became really agitated and began barking and growling at him.
Yeah, which I'm not surprised by considering their breed.
Yeah. So the paramedic was unable to access the main house until the second ambulance arrived, which was at 3:26 p.m.
Yeah, so another sort of 15 minutes or not quite.
over 40 minutes after the 000 call now.
Yeah.
We're talking about. So obviously there's now 3 paramedics on the scene. One of the paramedics was able to distract the dogs, allowing the other 2 to enter the house. Once they entered, they found Tony in the bathroom and it was apparent that he was deceased.
Yeah.
And he may have been when the first paramedic arrived.
Potentially.
As well.
Yeah, we don't know.
Yeah.
So, as I said, there was an EpiPen on the floor beside him, and it was later discovered that that EpiPen had expired in February 2014.
So what, a month or so before?
Less than. So it expired in February 2014, and he passed away on the 5th of March.
Yeah, right.
So, like, matter of days.
Yeah.
It expired by.
So realistically, it probably would have had efficacy.
Yeah, because it was only just
expired, but it just wouldn't have been guaranteed to the efficacy of
what
the prescription was. Yeah.
Mm-hmm. So that's the basic circumstances or facts that happened. Obviously, from these circumstances, the coroner explored a number of issues. First of all, he had a look at the 000 and ambulance response. And first of all, looked at whether the response time had affected Tony's chance of survival.
It sounds like it was pretty reasonable, but also so the dogs being out, presumably had the 000 call gone on for longer, they would have asked similar questions. I assume those sort of services now ask, is there any issues with access to your property?
Yeah, I think they mention if there are any dogs on the property, please. And
he wouldn't have been in any state to do it,
basically.
At which point they potentially could have asked for police assistance earlier, but without that knowledge, because he was uncontactable, I can't fault that from that perspective.
No. So there was evidence given by a consultant allergist that it was more likely than not that Tony died within 15 minutes of making the 000 call. So given the actual response time, which was the distance required to be travelled, even if the paramedic did have immediate access to Tony, without the dogs being an issue, it's unlikely that he would have survived.
Yeah.
Even if they'd done CPR and got return of circulation, he probably would have been brain dead by then anyway.
That's right. So the rate at which a person deteriorates is dependent obviously on a number of factors, and according to the expert, the median time is about 10 minutes, but it can be as quick as 2 minutes to succumb to anaphylaxis.
And I mean, we saw that with a previous anaphylaxis case that we did. She didn't succumb that quickly, but she changed so rapidly within minutes.
Yeah. Just the pure distance that the ambulance is needed to cover.
Yeah, and even if he was in the inner city, it still probably would have taken more than 2 minutes to get to him.
Well, that's exactly
May have taken more than 15 minutes.
So Sydney traffic, surely. There'd be a potential.
Trying to get to an apartment building.
Yeah, something like that.
Yeah. So the coroner did look at the average ambulance response times in New South Wales and found that the median response time, and this includes metropolitan Sydney, is about 11 minutes.
Okay.
Which is fast.
That is incredibly fast. But then to get there in 17, that still doesn't seem that far outside of the norm. Then.
No, that's right. It's not like they took an unreasonable time to respond.
Yeah.
And that was never in contention. So the response to Tony's call, was slightly longer than the average, again, due to the distance. But even if it was that average 11-minute response time, it's still borderline as to whether the ambulance
would have made it in time.
With that median response time.
And then then they couldn't get in because of the dogs anyway, which seems like it would have been difficult to have mitigated no matter what they'd done.
There was an ambulance station that was located a lot closer than what these ambulances were. So another aspect the coroner looked at was why was there no ambulance sort of in the vicinity of Tony's residence at the time. And that was something that the coroner explored mainly because that was a big question that the family had. And the family, I think, was quite involved in this inquest because they just wanted, and that was the main question they wanted answered was why was there no ambulances
nearby,
in the area at the time? Why did it take them so long? Not that the response was inadequate in terms of
the distance they had to travel.
Exactly. The paramedics did everything they could in order to get there in time, but it was more why was there no one closer to assist him? So basically the coroner explained that ambulances are stationed across various locations and may be directed to attend incidences outside of their areas if they are the closest available resource. And the availability of ambulances is continuously monitored using a highly sophisticated computerized system, and dispatchers are constantly sort of shifting crews and vehicles from areas of lower demand and cases of high priority and things like that. I'm assuming it's a very complex logistical nightmare, to be honest.
But I also feel like even if there had been one located closer, if that one then also got called out on a job, they then have to look at moving the next closest one into to recover from that area.
And you just can't predict what calls you're going to get on any given day and what's going to be, and one ambulance might be out at a job and they're not going to know that there's a closer, higher priority over here.
Because they're already on that job.
Because they're already dealing with something else.
And then you add, as time's gone on, we've got higher needs for ambulances than we do resources of number of ambulances. This was 2013?
14.
Yeah. So, even to now as well, we just have so many more calls than we have paramedics and ambulances to keep up as well. So then that adds a further pressure.
That's exactly right. And yeah, I mean, probably some of the calls they get are so low priority as well, but they still need to attend to them.
Yeah.
Yes.
At some point. So the closest ambulance station to Tony's home was still about 15 minutes away. So it wasn't, next door. But at the time of the 000 call, all 4 of those ambulances usually at that station were out and a lot further away from Tony's home. So the ambulance crew that was dispatched was obviously the closest available ambulance to Tony's home at that time.
Yeah.
So that was basically just what the coroner talked
to. Yeah. The answer is
that's how it happened.
It's a complicated process of logistics, how they do that, but
at least the coroner assessed that there was no better alternative that could have been considered.
That's right.
Or that there was no obvious solution to have rectified this because the way that the algorithm they're using isn't optimized or something like that, it does seem like it is an adequate use of the way that they distribute the ambulances to the various calls.
And it might not be a perfect system and it might not work 100% of the time, but it is the best system
that we've come up with so far.
Yeah. At this point in time, there might be improvements in the future, but it doesn't seem like in this case anything could have been done.
Was flagged. Yeah.
So the next issue they explored was, does the New South Wales Ambulance Service have a policy or practice in relation to treating patients guarded by aggressive animals? So the coroner found that the ambulance service had no specific policy. In general, it attempts to avoid the problem by requesting that 000 callers lock up pets, as you said, Alice. But it also, and quite sensibly so, takes the view that paramedics should not place themselves in any danger when attending to emergencies.
Yep, absolutely. Whether that is animal, whether that is other individuals, storms, weather events, all that kind of stuff. The answer is you make sure that you're in a safe environment before you do anything.
You've got to
first.
Protect yourself before you assist others.
Assess for danger first, Dr. ABC.
That's exactly right. And paramedics are also not armed with any sort of equipment to deal with aggressive animals. And I sort of talked about like capsicum spray and batons and stuff to try and immobilize the animals.
Harming the animal that's doing what's in its nature to protect its property, or may on a farm have been kind of taught that behaviour.
Yeah, possibly.
I don't think is the right attitude either.
But then it's sort of like, it's that whole balance of what's more important. I mean, saving the person's life or...
It's hard though, because again, if that
spraying
dog has...
a dog with capsicum spray is not going to kill it. It's going to be very unpleasant and it's going to probably harm the dog mentally in the future.
I can't imagine the aggressive person wants to be sprayed with pepper spray. That if you... Not saying that they're equivalent, but it's that same thing about you shouldn't be harming others if you don't need to. But also if those dogs have been taught to be protective of the property and Tony owns those dogs to protect his property, knowing that is what he's taught them, then he also has to take responsibility for that and understand that limits his ability to have a paramedic attend his house. I don't know, I find that I'm aware that if a paramedic tries to come to my house and Quinn tries to eat them, that I'm not going to get care.
So you're saying that there's a certain amount of responsibility you assume
on the
owner.
Yeah.
So the general policy, and which is what this paramedic did, is to call the police if they require any sort of assistance. So the ambulance service obviously provided evidence in this inquest, and they noted that there were 2 major issues with developing a policy for dealing with situations such as the one that was brought up in this case. The first one, I personally don't agree with these views, but we can discuss. The first reason was because the paramedic program is very full and that the priority is training paramedics in the core business of providing emergency clinical treatment, and that training them in animal handling is a low priority.
I don't think they should be expected to be trained in animal handling.
But they should be expected to know that's a potential. But I suppose
that.
But also what animal?
Part of dealing with your situation, because obviously they're being called out to lots of different
places,
scenarios. But they shouldn't have any specific
animal
dog handling. What if there's a horse in the way?
That's what I mean.
What if there's a herd of sheep in the way?
Snake. It's the
Mhm.
pet snake. Do you think that you need to be responsible for
That's right.
the animal handling of the
Yeah.
pet snake? I agree. The horse, the donkey, the elephant. Depends where you're going.
That's right, and that was literally their second point, was the range of animals is so wide that it could be difficult to develop policies and procedures for them all. But I just think that, like, yes, I completely agree with that. Like, you're not going to need to know generally how to deal with an aggressive snake or whatever, because
What if
that's
there's a
very rare.
really aggressive parrot? It's loose in the house.
Whatever it is, the
How do you
budgie,
deal with
the
that?
killer budgie. But I feel like dogs.
But
They're
again,
more common.
but the handling can be so variable because
That is
a
true.
dog can bark
specific
because
dog.
like they're protective because this is an unrecognized person.
Yeah.
Or
they
a
might be
dog can
super
bark
excited.
and attack.
Yeah, you don't know their threshold and you don't know what their escalation level is. Because they could not bark at all and then all of a sudden bite you.
And the damage that can be done to an individual by a dog is going to be very different to the killer budgie that we've just talked about.
Or the cat that's really annoyed at you.
Yeah, and so I think that because that's so variable and
So you don't think that paramedics should have any sort of training about how to deal with dogs? Like, not because at this point they don't even get told what to do.
I feel like there should be some level of procedure, but it's so variable because you could have a really aggressive Chihuahua or you can have a really aggressive Great Dane, and the way that you deal with both of those dogs
It's gonna be
is going
so
to be
different.
quite different.
paramedics get training on their level of fitness because they might get put in situations where they're going to have to hike a hill or be
Or
in
lift
rocky
heavy-
situations and all that kind of stuff. But I imagine a lot of that is more on the job experience / lifestyle experience of things rather than as part of your training, you're going to go hike this mountain because you need to know how to get to the top.
Yeah, we need you to hike this mountain so you can prove that you can before you become a paramedic.
Yeah.
I don't think that happens.
But they do have like mandatory, like they have to be able to lift certain weights and all that kind of stuff as a team in these scenarios because you've got to be able to lift a body weight.
Person.
You know.
Yeah.
But like, so I'm thinking of when we did, is it Ewan's case where he was the 17-year-old,
Yes.
well, no, the 14-year-old boy that was adult body weight.
Yeah.
But it happened to be that those volunteer paramedics were ex-military or whatever that therefore had those kinds of skills around heat exhaustion. And heat exhaustion is a medical issue, but they had above and beyond experience around it. But otherwise, the general paramedics experience would be your standard first aid. So like, I think there's also a balance between having a general brush over of knowledge as well and having a more extended knowledge into it. So maybe, sure, paramedic training could involve some, when you approach a dog, you will need to consider what's safe for yourself kind of explanation more than how do you handle a dog.
Yeah.
Does that make sense? Like, I think it should still be primarily on how they keep themselves safe rather than
and how
No,
they
I
feel in that situation.
Yeah.
That maybe they're comfortable with bigger dogs, but they might not be, and therefore elect not to go anywhere near them, which is fair enough.
absolutely fine.
And I completely agree with all of that. I do think there should be more of a specific policy in place of what to do because remember, there was no policy. It was just that if there's any issue
Call
that
the
you're
police.
worried about your safety, call the police. But I think there should be more of just acknowledgement almost that you may come across aggressive animals on the property and
this is what you should do.
Yeah, true.
The coroner's response to all of that was that he believed it would be relatively easy to provide advice to paramedic trainees on how to manage dogs without overstretching the training course.
I have a dog and I don't think it's easy to manage them, let alone learn how to do that. I just don't know that it's as simple as that.
I
think you
agree,
can give a base level of understanding, but you
just
can't talk about specifics.
And again, he sort of narrowed it to dogs and not.
Oh, yeah, even with dogs, like even narrowing it to that, I think it's hard to still...
You can't really prescribe this is what you should do in this order because every situation is going to be different.
Yeah.
And I should note that this particular paramedic, the Rapid Response Unit paramedic, was completely unfamiliar with dogs.
Yeah.
Just no knowledge of them whatsoever.
Yeah. And even if you did have a really good knowledge of dogs, I still think it's very reasonable that they didn't enter that property.
Oh, I agree. If they're feeling threatened by a dog growling at them, I don't think.
That's the other part, though, as well, if he was completely unfamiliar with dogs. There's also only so much a theoretical knowledge can give you around dog handling. I could read forever and a day about how to handle a dog, but unless you actually have exposure to any form of dog, and then also understanding the difference between a little dog to a big dog as well, unless you have exposure to that, I think that's also really difficult to comprehend in terms of how to manage a dog then.
And animals have such different reactions, and if you're completely unfamiliar with like how animals react at all, like is that a friendly bark or is that a warning bark or is that like get away from me right now, I'm going to bite your face off bark?
There are
like,
enough
you just don't know.
people that have difficulty reading human behavior, let alone a dog's. Yeah. Again, I still say that I wouldn't want that to also be discussed at the detriment to learning something else in relation to their primary paramedic responsibility.
So on that vein, the next topic that the coroner explored was whether there was anything that paramedic could have done differently in terms of dealing with the dog. So the paramedic, as I just said, gave evidence that he felt really threatened by the dogs and that they were growling and barking at him and he felt unsafe, which I think is just sort of, enough.
Yeah.
But the coroner did get a veterinarian to provide evidence at the inquest, and that vet gave evidence concerning how to deal with canine aggression and advised that to calm an agitated dog, a rapport needs to be built by talking calmly, using treats and dog toys, etc.
Which are not in the ambulance.
You're not generally carrying a chew toy in the ambulance just in case you come across it.
Yeah.
Yeah.
And this paramedic, no paramedics are required to be equipped with treats or
toys.
Have any familiarity with dogs whatsoever. That's not a job requirement.
Yeah.
So the ambulance service stated that it is against providing any equipment to paramedics to deter aggressive animals, and they're specifically talking about capsicum spray and things like that.
Yeah.
This is because paramedics treat unpredictable and aggressive patients who might swipe equipment such as capsicum spray, which then, of course, could be extremely dangerous to the paramedics.
Or someone takes that wrong and thinks that they're about to get pepper sprayed.
Yeah, they might react very badly.
That's right. And the coroner completely accepted this position and said no.
It's not their responsibility.
It's not that, no, they just he just accepted the position and said no, they don't need to be carrying anything like that on them in order to distract dogs.
Okay.
But the ambulance service did indicate its willingness to consider crews carrying a small bag of dog treats or a dog toy to distract dogs when they're going onto the property. I don't know how well that would be.
But like it's not going to take up much space in the ambulance.
But also, where do you put it in the ambulance? And when you finally come across the dog that you want to subdue,
where are the dog treats?
Where are the dog treats?
Where do we put them?
Who fucking knows?
Unless there's a specific place that the dog treats go.
And again,
dog treats in here.
Yeah.
And again, is there a risk that someone gets into that and then starts eating the dog treat? I don't know.
I feel like there's not really a medical.
And like, how often do you replace them?
They do expire.
Yeah, they're not.
It would have to be one of those things where they do like the medicine checks.
Exactly.
Just to make sure the expiry date of the dog treats.
And so how much dog treats would just like get thrown away? Because I can't imagine that's
honestly,
common.
There would be a lot of dogs who are, if they're that agitated, they're not going to take treats anyway.
Exactly.
It wouldn't really work that much of the time, would it? Like,
unless they're super food motivated.
Unless it's a bit of steak that you can like chuck over there and they go get distracted. But even then, they're not going to they're probably going to continue to focus on the paramedics.
Because
so
the treat is less
appealing than protecting the property.
Well, that's exactly right. And that's their core job. They're like, I'm protecting the property. I'm protecting my human. I don't care about those treats.
Yeah.
So the final area that the coroner explored, which we touched on already, is could have the use of the expired EpiPen have had an effect on Tony's prognosis. So the coroner found that, basically, in short, it did not.
Yeah.
Okay, full stop. The evidence of the allergist was that the out-of-date medicines lose their efficacy very slowly, and in this case, the EpiPen was only out of date for a matter of days, which would have made no difference in terms of the efficacy of the...
That's really interesting that they were like, absolutely not a big issue.
Would have made no difference. The coroner sort of said the reality is that the problem here was the amount of adrenaline in the EpiPen was not enough to counteract
his anaphylactic symptoms. Yeah.
He needed another dose.
Yeah. Did it go into whether or not he would have, I guess they don't really know, if he'd given himself the second EpiPen, would that have changed anything?
So it potentially could have.
It may just prolong the
situation, but they can't be.
Yeah, we'll never know that. Yeah.
Yeah.
So out of this, the coroner made 3 core recommendations. The first being the New South Wales Ambulance Service consider equipping its emergency service vehicles with a stock of dog treats or a dog toy to be used to distract dogs if necessary while attending emergencies.
I am looking forward to looking this up later to see if that has been enacted or if anyone has just been like, that is ridiculous.
But even just like, imagine reading that recommendation with none of this context. You just be like, what?
Dog treats?
Yeah, it's like, how did
Totally.
this come about?
I can only imagine me like, of all the things to be recommended, not like, can the coroner recommend that we, increase this safety requirement or store more of this medicine because it'll be
Training
helpful or whatever. No, just
procedures. No.
please take some
treats.
dog treats or dog toys with you.
Please make sure there's dog treats in the ambulance.
This is a New South Wales health policy.
Yeah.
You aren't allowed lunch breaks. You have some dog treats or some toys to play with. Happy days.
Brilliant. The second is that the New South Wales Ambulance Service incorporate into its practice scenarios used in training and professional development of paramedics a situation based on the facts of this incident.
See, that I
that
could
would
get
be
on
very
board with.
helpful.
Yeah.
Because simulation training can really improve your ability to do something if you've already done it once before. It might not be exactly the same, but think
that
through those
pattern
times.
recognition.
So doing stuff around
There's a dog on the property. What do you do?
Even just
Like-
working that through.
Exactly. And
Yeah.
just so the next time that you face that situation, you're not panicked.
Yeah.
You can think about, okay, oh yeah, I remember we once did something about this.
And if this happens and if the dog is still aggressive, then this is what I need to do.
Yeah.
But, chuck the dog treats that you're carrying in your
that you've already found out of your ambulance because you definitely know which cupboard it's located in.
Exactly right. That should be the policy. That's where the dog treats are kept.
Yep.
Throw them on out, distract the dogs. And then the final recommendation is that, again, to the New South Wales Ambulance Service, through a suitable medium, disseminate to its on-road and other staff a list of tips based on the vet advice for calming apparently aggressive dogs.
Oh, okay. I think this got very focused on the dog
Yeah, it
situation
really
that
did.
I'm really not.
Reading one tip sheet one time, you're not necessarily going to retain that information.
Every dog
I
is so
think
different.
situational
It
training would be
depends.
much more embedded in your brain than just a tip sheet, because in that situation, you're not going to bring out your tip sheet.
No,
You're like,
that's
okay,
exactly right. I
step
definitely
one.
I think the scenario-based training is probably the most
helpful. Yeah, I agree.
helpful of all of those recommendations. But yes, this inquest was definitely focused on the dog.
Because I guess there wasn't
Wasn't really anything else.
Yeah,
there
I
were no
get it.
deficiencies elsewhere.
That's right.
Well, they did go through other stuff and they went, yeah, check. That is
Yep, that
actually
is-
adequate.
yep.
That is adequate.
Mhm.
Okay, I get why I get so focused on the dogs then.
Yeah,
It's the one
that's
place
right.
where they can make a change.
where they can
Yeah.
actually make a difference. So,
But
yeah.
I'd just be interested to know what the behavior of these dogs is normally. I would love for the family to have provided, there was no chance. Roy and Friday, don't ever let any random on this property. So
Even our friends that don't
Yeah.
even let the friends enter the
or
property.
that was very unexpected for Roy and Friday. So
Yeah.
the paramedic should have known better.
yeah.
Yeah.
But should have the paramedic known better?
No,
they
they
just
wouldn't.
didn't know anything about dogs.
No, but or the paramedic should have been able to get on the property then.
Yeah.
You know what I mean?
Yeah. But yeah, this is not a very extraordinary coroner's report in terms of its facts, just an anaphylactic shock to a wasp sting.
Yeah.
And a pretty routine
I'm interested
response.
by better systems around informing people when their EpiPens are expired.
That would have been interesting.
I'm surprised that they
yeah.
haven't gone into anything of why isn't there a reminder generated with your EpiPen to notify you when it expires?
Yeah, maybe even a month
That's a good
before it
point.
'Cause-
expires. Hey, you need to get another script for
Yeah.
this.
Yeah. If you haven't used it, please renew.
Yeah.
Anyway.
And we don't know, the second EpiPen might have been.
It might have been even more
I would have
expired.
thought you generally get
potentially.
both of them at once. So I imagine they're probably
okay.
of the same batch or very similar expiry
Well,
dates.
interesting, because if his last prescription was less than 12 months,
But-
maybe he just hadn't had that script filled.
No, I think that's probably the
That's probably
expiry
the
date.
expiry time.
Yeah.
Okay. But yeah, no, there was no discussion about that. I think because...
And again, so if you know EpiPens do expire every 12 months, then he should have had another GP appointment booked to have it replaced. The moment you get it prescribed, the GP should be saying, well, we schedule you in for
next year.
11 months from now
Yeah.
to get your new script and for you to check, blah, blah, blah.
Yeah.
Things like that. And it didn't go into had any of that been discussed with him or how regularly was he using his EpiPens and all that kind of stuff around. Because it sounds like he's had a number of
He's had a number of...
needs
yeah,
of use for it.
Yeah.
But the problem is, anaphylaxis can be so infrequent and between
variable
episodes
with each response, right? Like,
that a lot of people can have risks of having expired EpiPens, not knowing where their EpiPen is.
mm-hmm.
So,
And I think the reason why the coroner didn't explore it was obviously because they just found that it didn't have any effect on this particular
fair.
case.
Fair.
Which is
That's
why
true.
he didn't
That's
kind of
true.
go in. But I still think it's a valid point.
Yeah. Anyway, just one of my bits of like, I wish they'd delved deeper into that.
Yeah. But it was definitely more focused on the aggressive animals, which I found interesting, and I think mainly because of the background of there being that similar incident that happened
Recently.
in Queensland recently, which was very tragic, but obviously a completely different set of circumstances where...
And, there's not enough information released now for us to even know what led to that scenario happening.
Well, exactly right, apart from the fact that it was, a routine check on the property.
And
whereas this was not a routine.
Yeah.
This was a, unpredicted event that occurred. And so therefore it was not unreasonable for the dogs to be
protective.
Out and loose and protective.
Yeah.
Exactly. Because as Alice said, I think the general procedure, if a paramedic is going into the property, that they do ask for any aggressive animals to be locked up, but that just wasn't possible here.
Yeah, exactly.
Yeah.
But so as I said, not anything super, I guess, extraordinary, but I think that also is what makes it interesting, is that could just happen to anyone. Like, that's just such like, you have a dog.
Yes.
What if something happened to you and you were home alone and Quinn started becoming protective?
Oh, she absolutely would.
Exactly.
Yeah. And, like, the problem is, like, I know she's a softie.
Mm-hmm.
The moment a paramedic walked into my door, if they, like, became submissive to her, she'd roll over and ask for a belly scratch.
But they wouldn't know to do that.
Exactly, but they don't know that. Yeah. So she absolutely potentially would, therefore, continue to behave barky and aggressive towards them.
Mm-hmm.
And you may also not know because you've never had a stranger come into your house that hasn't been
I have
invited. Oh, yeah.
Had some guy climb over our back fence, but that's a whole other issue.
But, like, you know how she would react to you, but you don't necessarily know how she would react to someone else.
Exactly.
In your house, especially if she knew something was wrong
with you. And
exactly.
Then when
she might react in a very different way.
Yeah. And I absolutely think it could be a risky scenario.
Yeah.
Yeah.
And so I wouldn't want to ever place anyone in that position, so I would never expect anyone to therefore, try to attempt to look after me if that was putting them at risk.
Yep. So that's obviously a risk you assume, but do you think everyone assumes that?
Yeah, I was going to say, I'm in the medical field. I know, like, I have a different perception on these kinds of concerns.
Most people would not think about that at all.
Yeah.
I honestly wouldn't have thought about that, to be honest. I don't have a dog, but I'm saying if I did.
I absolutely have thought through of, like, what happens if shit goes poorly. We read these. How do you not think about these things?
I guess because I don't have a dog.
Yeah.
You've got 2 cats who would probably do nothing.
They would do absolutely jack
They would
shit.
be so hidden.
Yeah, they would be so far in the back of the cupboard.
I can count the number of times I've seen your cats in my life.
Exactly. But do you think that your dog would be distracted by treats?
Not in that instance. Not even in the slightest.
If the paramedic came with a squeaky toy?
No,
she wouldn't.
No, wouldn't make it better. Not even a little bit. Right. It'd have to be a whole chicken carcass to get her remotely interested.
Paramedics are carrying a chicken carcass.
Yeah, that's what I mean. Like, any dried dog treats are not going to be enough. No. Yeah. So, like, I have a fundamental issue with that of, like, it just seems unreasonable for me.
But it wouldn't work for all.
No.
But I mean,
and I think
some is better than none, right?
Yeah, true, I guess. Okay, sure. Yeah, that's an element. But again,
I mean, no harm, no foul. Like, right? They throw the dog treats and the dog doesn't do anything. All right, well, at least we tried
I also think that the instance where the dog treats are going to work are the instances where there's not as big a threat to the paramedic. And I think that, therefore, there's potential element that even without the dog treats, you'd still get somewhere.
Be able to, yeah.
Whereas the dogs that are not responding to the dog treats, having had the dog treats, would have been pointless in the first place. And so it's not changing that outcome to me. I don't know. You're better at being the expert on this, Alice, but like, I just think that the times where the dog treats are going to work, that it would have been solvable some other way anyway.
Possibly.
Okay.
Yeah.
Not always. It's hard to tell.
Yeah, it's hard to know.
Yeah.
Each individual situation, each individual dog will react to things very differently.
Yeah.
Yeah. So again,
But yeah, it wouldn't make things worse.
Yeah, no harm, no foul, right? Like,
Yeah,
give
true,
it a go.
true.
Unless the dog was super protective of also food.
At which point they
And then
bite
you
your
throw
arm
the
off.
food and
yeah.
then it's, now you knew my food.
Yeah.
But that
But
would
logically,
just
you would throw it away from you.
yeah, that's right. And
You
that would
wouldn't
just
put it right
distract
next
the
to you.
dog to that anyway, wouldn't it? So you'd just be like, all right, get into the
Possibly.
property, lock yourself in.
Then,
Again,
then you're stuck in there.
it's going to be, well, then
Yeah,
the
then you
other
can't get 'em
ambulances
out.
would come and it'll be fine.
Or would
Um,
it? Because maybe they wouldn't be able to get past the dog, and then you're stuck inside this house.
Just so many
Being guarded
variables,
by a
right? And
dog,
like,
yeah.
in this circumstance, the dogs were outside.
Yes,
Yeah.
they might be
And-
inside.
And then, like, how would you deal with that situation? And
Yep.
Exactly.
yeah, there's just so many variables. But dog treats and toys in the ambulance it is.
Yep.
I mean, to be fair, I can't come up with a better solution. So
True. I mean, a lot of these, none of us are coming up
No.
with better solutions. It's
No.
just interesting. Yeah, this is the first time I've had one where I've been quite, or maybe I'm wrong, but like I feel they've been quite so contentious over the coroner's recommendation being like, what?
yeah, it's a bit. It
Mm.
seems strange on the face of it, but then you're also like, could I come up with an
No,
alternative?
no.
No. So
But it seems like the expert witness vet was all on board with like, yeah, you could have just like,
well,
You
the
seem to
expert-
know
No,
better.
that was more. I think that was more of a generalized statement of this is how you could
Yeah,
Yeah,
that's
do
right.
it. It's not a prescriptive.
and
this is
the-
going to work every time.
And
Yeah,
the expert
okay.
very much said, like, this is how, like, dog behavioralists
Yeah.
would deal with this
And
situation.
they would have more time to work with the dog. It's not an emergency situation.
Yeah, okay.
Exactly. But noting that paramedics are not animal behavioralists and they don't know how to build rapport with dogs.
Not everyone's multi-talented in multiple professions.
That is not in their job description. So,
Seems fair.
and it's interesting because, yeah, as I said, there was obviously this paramedic, the first one that was on the scene, who's very unfamiliar with dogs. Obviously, the one who distracted the dogs is probably more comfortable
Yeah.
Doing that, yeah,
with
yeah.
dogs. So again, it's just like that background of what
Yeah.
you have and what you're comfortable and familiar with. Because I can totally understand if you've never had dogs in your life and one starts barking at you,
Oh, yeah. You're not going to want to go near them.
Go near it. Like
Yeah.
there are some people who are more comfortable with dogs would be again able to identify like it's being aggressive, but I'll be able to calm it down maybe by doing this.
Yeah.
I don't know. But yes. So yeah, and interesting. It was just I don't know. It was one that just piqued my interest when I
Yeah,
read it. It was one of
sure.
those ones where I was like, I'm not going to skim right past this one.
Yeah.
We all have those. There are so many that pique our interest, right?
Exactly right. But yeah, as I said, nothing sensational in comparison to a lot of the ones we do. But yeah, interesting and interesting recommendations, as you both pointed out.
Yeah, definitely.
So thanks all for listening. Join us next time for a new episode of Coronial.
Bye. Bye.